So, this is the story of Jenny and Dr. Jen. This is Jenny, and this is Dr. Jen. So, Jenny is prescribed to use nasogastric tube feeding by Dr. Jen because of gastrointestinal tract problem she faced. Dr. Jen tells Jenny that the enteral tube feeding is used to feed patients who cannot attain an adequate oral intake from food or oral nutritional supplements, or who cannot eat or drink safely. The aim of enteral tube feeding is to improve nutritional intake and so improve or maintain nutritional status. A common type of enteral tube feeding is nasogastric tube feeding. It is a flexible tube that can be inserted through nose into stomach. Nasogastric tube feeding is the most common method of providing short-term artificial nutrition support in acute setting. Nasogastric tube feeding should be considered for a patient who have a functioning gastrointestinal tract and require short-term tube feeding up to 4 to 6 weeks. The insertion of a nasogastric tube facilitates access to the gastrointestinal tract, enabling nutrition and medicines to be administered, while other assessment or therapies are being carried out. But Jenny is afraid of it, as she thinks that it will be painful and maybe her nose might become bigger or there might be holes poking out from her stomach. Dr. Jen tells Jenny not to worry, and she will explain to her about how the process is done. The procedure to insert nasogastric tube is: sit the patient in semi-upright with the head supported with pillows and tilted neither backwards nor forwards. Measure the tubing from the bridge of the nose to the earlobe, then to the point halfway between the lower end of the sternum and the navel. Mark the measured length with a marker to note the distance. Lubricate 2 to 4 inches of tube with lubricant. Pass the tube via nostrils. Pass the tube into the pharynx and the esophagus, and then into the stomach. So now we will demonstrate our prototype NG11.
Can you smell to eat? NG11 is ready to serve us.
Jenny is able to understand clearly, but she wonders about whether there is any potential complication that she might experience from it. Dr. Jen tells Jenny that some patients might experience vomiting, diarrhea, constipation, and lung aspiration. But our nurses will take good care of you, so don't worry. Just sit back, relax, and enjoy. So Jenny is relieved, and she thanked doctor for the explanation.
What are you waiting for? Visit our website now to order NG11.